Hi guys, I'm Michelle from Virtual Hand Care, and if you had trigger thumb release surgery and you're wanting to improve your thumb range of motion and get back the use of your hand fast, then follow along with me for 7 exercises that you can do after your trigger thumb release surgery. And actually, these exercises can be started a few days after surgery and even up to 4 weeks or longer if you need it. We are gonna do 10 repetitions of each exercise and no equipment is needed. But of course, always check with your doctor before you start exercising. But if you're good to go, let's get started. Okay, exercise 1 is thumb IP blocking. This exercise is gonna start moving the long flexor pollicis longus tendon, the one that's responsible for making the tip of your thumb trigger. But since you had surgery, there shouldn't be any more of that. So to do this exercise, you want to use your other hand to block right below the first crease of your thumb. That's your thumb IP crease right here. Now, if you just had surgery, you don't want to have the thumb all the way up in too much extension and try to do this exercise. It just might be really uncomfortable for you. So make sure you get in a starting position that feels comfortable. And then what you're gonna do is just bend and straighten the tip of the thumb as much as you can. Let's do 10 of those. Ready? So bend and straighten, and that's 1. Down and up, that's 2. Down and up, that's 3. Down, up, that's 4. Down and up, that's 5. If you want, you can go ahead and try to bring that thumb down maybe a little bit more and try to do this exercise. Bend and straighten all the way to, that's 6. Bend as much as you can. Straighten as much as you can. That's 7. Flex and extend. That's 8. Bend and straighten. That's 9. And bend and straighten, and that's 10. And like I said, to progress this exercise, you can kind of play around with the position of your thumb. You can bring your thumb a little bit closer to your palm, and you can try to do that exercise as well. You can bring that thumb a little bit up in more extension, and you can try to do that exercise. Those are just some ways to progress this exercise and make it a little more challenging. Okay, exercise 2 is called thumb C's. So to do this exercise, you're gonna rest your hand down. Make sure you get your fingers as straight as you can, and then you wanna bring your thumb as close to your index finger as you can. That is called thumb adduction. Then what you wanna do is you're gonna go ahead and abduct your thumb, so bringing that thumb away from the index finger. But I want you to go ahead and curl those fingers and curl that thumb a little bit into a C position. So you're trying to make a C out of your fingers and your thumb. You're gonna hold that for a couple of seconds, and then you wanna go ahead and adduct and bring that thumb closer to your fingers. All right, so let's go ahead and do 10 of those. Ready? Bring that thumb out into a C and bring those fingers out into a C position. Hold a couple of seconds. And then relax back to that adducted position. And that's 1. Back out into that C. And back. And that's 2. And back. And that's 3. I'll go ahead and change position so you can see that a little better. And C position. And back. And that's 4. Back into that C. Just go as far as you can. And back to adducted position. And that's 5. And back out into that C. Back into adduction, and that's 6. And back out into that C. Hold for a couple of seconds. back into adduction, and that's 7. Bring that thumb away, abduct, really work in those muscles, those thenar muscles of the thumb, holding, and back, and that's 8, and back out, and back in, and that's 9. Let's do one more. Back into that C position, hold, and back into adduction, and that's 10. Good job. Okay, exercise 3 is thumb O's. So what we're gonna do is try to make an O with our thumb and each of our fingers. But we want to just start with the index finger. You might not be able to touch all of the fingertips at first, and that's okay. So let's go ahead and first just start by trying to make an O with the index and the thumb. And we're going to do that one 10 times, and then we'll try to progress, but only if you can do that at this time. All right, ready? So extend your thumb out as far as you can and straighten those fingers up. And then you want to go ahead and try to touch the tip to tip. So tip of index to tip of thumb, making an O, and then open all the way. And that's 1. Go ahead and go back to the index and open. That's 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, now try to go to the middle finger if you can. If you can't get to the middle finger yet and there's like an inch away, that's okay. Just go as far as you can. Eventually you'll be able to touch that middle finger. So go ahead and touch if you can. Ready? And open. That's 1, 2, 3, 4. Really make sure you open after each one. And touch and open. That's 5, 6, 7, 8, 9, and 10. All right, now let's try to go to the ring finger and open, and that's 1, 2, 3, 4, 5, 6, 7, 8, 9, and touch the ring finger and open all the way, and that's 10. All right, and if you can, touch that small finger again, trying to make an O. And sometimes that can be hard to do, especially early on after your surgery. So if you're only here, that's okay. Your exercise will kind of just look more like this. And eventually you work to touch the tip of the small finger. All right, and then you open all the way. So that's 1 and 2, 3, 4, 5, 6, 7, 8, 9, last one, and 10. All right, and so exercise 4 is thumb across your palm. So you want to try to bring that thumb all the way across your palm to try to touch the base of that small finger now that your thumb's a little more warmed up. Again, if you can't touch all the way, which you very well might not be able to because you might have quite a bit of swelling, you just do that movement as far as you can and hold a second or two, and then you're going to straighten that thumb all the way out. Okay, so go ahead and bring that thumb around the palm, trying to touch the base of the small finger as far as you can go. Fingers can be nice and relaxed when you're doing that. And then straighten all the way. And that's 1. And again, move that thumb as far across your palm as you can. Hold a second or two. And open all the way. And that's 2. And again, across your palm. And open. That's 3. And again, flex all the joints of your thumb across your palm. And open. And that's 4. And across. And open. And that's 5. You're halfway there. And bend. And straighten, and that's 6, and bend, and straighten up as much as you can, that's 7, and bend, and straighten, that's 8, and bend, and straighten, that's 9. Let's do one more. And bend. Hopefully each one you've been able to go a little bit farther and farther across your palm. Maybe you can even touch now, maybe not, and that's okay. Hold that. And then straighten, and that's 10. All right, exercise 5 is called a hitchhiker. So what you're gonna do is curl your fingers. You can just rest your hand down on the table or your lap. And you're gonna start with your thumb on the side of your index finger, just nice and relaxed. And then you want to go ahead and straighten or extend that thumb up into a hitchhiker position as much as you can, trying to get a nice little stretch of the tissue, the skin, the tendon, all along that palm side of your thumb. Holding, and then you're going to go ahead and just rest back down. Ready? Let's go ahead and do 10 of those. So up in as much extension as you can, as what is comfortable for you, and then go ahead and rest back down. And that's 1, and lift, and back down. That's 2, and lift, and back down. That's 3, and lift, and back down. That's 4, and lift. If you can't go that far, just lift even a little bit off your index finger. That's okay. And back down. That's 5. And extend that thumb up, making sure you're trying to get a little bit of hyperextension of the thumb if you can. And back down, that's 6. And extend that thumb. And back down, and that's 7. Lift. back down, that's 8, and lift, and back down, that's 9. Let's do one more, and lift, and relax, and that's 10. Okay, exercise 6 is tendon glides. So this exercise is going to get the long flexor tendons to the fingers and to that thumb. We're going to get those moving and gliding together. This is also very helpful for pumping some of that swelling that you might have in your hand out of there. So to do this exercise, you're going to straighten your fingers and your thumb as much as you can. And then you want to go into what's called a hook or a claw. And so I want you to make sure that you are bending that thumb as well with those fingers. And then you're going to go ahead and from that hook or that claw fist, you're going to go ahead and curl down into a full fist and go ahead and just try to bring that thumb anywhere along the fingers that might feel comfortable. If that's bothering you because of your incision, just go ahead and place that thumb kind of on the side. And then you're gonna go ahead and go back up into that hook or that claw fist. That's where the large knuckles are straight. And then you wanna straighten up the fingers and the thumb that way. Okay, so let's do all of that together. So straighten those fingers, go into that hook, and then that full fist. Again, placing the thumb wherever is comfortable. Back up into the hook, and straight, and that's 1, hook, fist, hook, straight, that's 2, hook, fist, hook, straight, that's 3, hook, fist, hook, straight, that's 4, hook, fist, hook, straight, that's 5, or halfway there, hook, fist, hook, straight, that was 6, hook, fist, hook, straight, that's 7, hook to a fist, back up to that hook, and straight, and that's 8, hook, fist, hook, and straight, that's 9. We've got one more, back into that hook or that claw, making sure the thumb is doing that too, into a fist, again placing that thumb on the side or in front of those fingers, wherever's comfortable. Back up into that hook and straighten all the way out, spread those fingers and that thumb, and that's 10. Good job. And finally, exercise 7 is wrist flexion and extension. So your FPL tendon crosses your wrist. So it's really important to make sure that we get that wrist moving as well. So to do this exercise, you're gonna relax the fingers and the thumb, and then you wanna go ahead and bend that wrist forward as far as you can, and you'll notice your fingers and even your thumb kind of open up a little bit. And then you're gonna go ahead and bring that wrist back as far as you can go. And if your fingers are truly relaxed and your thumb is relaxed, you'll notice that those are curled. And you're gonna just kind of let that natural movement, that's called a tenodesis in the therapy world, you're gonna go ahead and just kind of let that natural movement happen. All right, so let's go ahead and do 10 of those. Ready? So bring that wrist forward, really just relaxing the fingers and the thumb. And then go ahead and bring that wrist back, again, making sure everything's nice and relaxed. And back to neutral, and that's 1. And wrist flexion, and extension, and neutral, and that's 2. Flexion, extension, and that's 3, Bend that wrist forward and back. And that's 4. And you're even getting a little bit of thumb movement here without even having to actively move your thumb. Bend that wrist forward. Bring that wrist back. And back to neutral, and that's 5. And go ahead and go into some flexion and extension. And that's 6. Flexion, extension, that's 7. Flexion, extension, back to neutral, and that's 8. Wrist flexion, wrist extension, back to neutral, that's 9. And again, last one, wrist flexion, come down as far as you can. And bring that wrist back as far as you can, in extension, and back to neutral, and that's 10. Good job. Now let me know in the comments how these felt for you. Was there one exercise that was pretty difficult for you to do? Or maybe you were just surprised at how much you could move your thumb. And as I mentioned before, make sure you save this video so you can do these exercises 2 to 3 times a day. And over time, I promise they will get easier for you. Now, if you found this video helpful, do please give it a like and hit that subscribe button below. And if you're looking for more ways to increase your thumb range of motion and strength, then check out more of my videos here. Until next time, thanks for watching.